When I turned 50, my wife Debbie insisted I get a complete physical, a total physical. So I went to the family doctor and he did the total physical, and one of which is the blood test. And one of the blood tests, things they check for is your PSA. My PSA was way too high.
Dr. Pete Hoffman, radiation oncologist at the Rex Cancer Center, says the PSA test, or prostate-specific antigen, is both a marker for normal prostate activity and for prostate cancer. In Grady Jeffries' case, it was the latter, cancer.
The rectal exam was perfectly normal, but the PSA was mildly elevated, resulting in a biopsy. Fortunately, it was very low-grade tumor, very treatable.
With better chance of survival because it was caught early, only because Grady's wife insisted he have that physical.
I would have put it off. I would have put it off until I felt something was wrong. Probably another 10 to 15 years before I would have started noticing some problems. It would have spread further than the confined area of just the prostate, and it would have been in major surgery.
Early detection allowed Dr. Hoffman to treat Grady with radiation seed implants, avoiding surgery altogether. Before PSA testing began, Hoffman says 70% of his patients had palpable prostate cancer before they were aware anything was wrong.
Today, with PSA screening, 70% of the patients I see have no palpable mass. The earlier stage, the better the chance for a cure.
Just ask Grady Jeffries.
Doing great. In fact, the best doctor visit I've ever had was yesterday when Dr. Hoffman told me I did not have to see him again.
And he is now out over 5 years and has no evidence of recurrent cancer.
Dr. Hoffman says 5 years and my PSA had dropped to 0.05, which is fantastic. Doing it, finding it early, getting rid of it early was, great for me.